Question 1. Which of the following clients should the nurse assess first? A. Client complaining of mild abdominal pain. B. Client with a respiratory rate of 8 breaths/min. C. Client requesting a snack. D. Client scheduled for discharge. Answer. B. Client with a respiratory rate of 8 breaths/min. Question 2. UAP asks to help with applying oxygen. What is the best response from the RN? A. Go ahead and apply nasal cannula. B. You can adjust flow rates if needed. C. Please let me do that, it's a nursing task. D. You may apply it, but I'll set the rate and monitor. Answer. D. You may apply it, but I'll set the rate and monitor. Question 3. What is the best action when a UAP expresses uncertainty about a delegated task? A. Insist they complete it. B. Reassign the task to someone else. C. Clarify expectations and provide guidance. D. Remove the UAP from the assignment list. Answer. C. Clarify expectations and provide guidance. Question 4. Which task is appropriate for the RN to delegate to an LPN? A. Initiating chemotherapy. B. Teaching colostomy care. C. Monitoring a stable tracheostomy. D. Discharge planning. Answer. C. Monitoring a stable tracheostomy. Question 5. What task can be safely assigned to a UAP for a stable client? A. Interpreting blood pressure trends. B. Collecting a clean catch urine specimen. C. Performing a sterile catheter insertion. D. Assessing skin turgor. Answer. B. Collecting a clean catch urine specimen. Question 6. Which action shows appropriate supervision by the RN? A. Assuming the UAP will report abnormal findings. B. Ignoring incomplete documentation. C. Asking for feedback after task completion. D. Letting the UAP handle patient complaints. Answer. C. Asking for feedback after task completion. Question 7. What is the priority when delegating tasks during an emergency? A. Assigning the least experienced staff. B. Giving verbal orders only. C. Matching tasks with competence and scope. D. Asking UAPs to handle assessments. Answer. C. Matching tasks with competence and scope. Question 8. A client on fall precautions asks to go to the bathroom. Who is the best team member to assist? A. Charge nurse. B. UAP familiar with the client. C. RN assigned to another unit. D. LPN giving medications. Answer. B. UAP familiar with the client. Question 9. Which client can the LPN be assigned to? A. A newly diagnosed stroke patient with expressive aphasia. B. A stable client 2 days post-appendectomy needing wound care. C. A client requiring initial Foley catheter insertion. D. A diabetic client in hypoglycemic crisis. Answer. B. A stable client 2 days post-appendectomy needing wound care. Question 10. Which action is most important after assigning a UAP to reposition a patient? A. Provide written instructions. B. Observe for skin integrity afterward. C. Assume it was done correctly. D. Reassign the task to verify compliance. Answer. B. Observe for skin integrity afterward. Question 11. The UAP reports a client has not voided for 8 hours. What is the nurse's best response? A. Ask the UAP to offer more fluids. B. Perform a bladder scan. C. Wait until the next shift. D. Reassign the UAP to another patient. Answer. B. Perform a bladder scan. Question 12. A nurse notices a UAP transferring a client without a gait belt. What should the nurse do? A. Remind the UAP immediately and ensure safe practice. B. Ignore unless the client falls. C. Document the incident for the supervisor. D. Take over all future transfers. Answer: A. Remind the UAP immediately and ensure safe practice. Question 13. Which of the following is not within the UAP scope? A. Assisting with oral care. B. Teaching how to check blood glucose. C. Weighing a patient daily. D. Repositioning a bedbound client. Answer: B. Teaching how to check blood glucose. Question 14. The RN asks the LPN to monitor a post-op client. What is a correct expectation? A. Teach deep breathing exercises. B. Evaluate pain management effectiveness. C. Observe for drainage or bleeding. D. Plan discharge follow-up. Answer: C. Observe for drainage or bleeding. Question 15. What is the most effective strategy to reduce delegation errors? A. Delegate tasks only when overwhelmed. B. Limit delegation to UAPs. C. Clearly define task expectations and responsibilities. D. Use verbal orders only. Answer: C. Clearly define task expectations and responsibilities. Question 16. Who should the RN assess first at shift change? A. Client asking for coffee. B. Client with BP 134/86 mmHg. C. Client reporting sudden numbness in left arm. D. Client due for scheduled medications. Answer: C. Client reporting sudden numbness in left arm. Question 17. Which action by an LPN requires intervention by the RN? A. Reinforcing hand hygiene instruction. B. Documenting wound appearance. C. Titrating oxygen without order. D. Monitoring urinary output. Answer: C. Titrating oxygen without order. Question 18. A nurse assigns a UAP to check a client's temperature. What outcome is expected? A. The UAP evaluates fever cause. B. The UAP documents the result and reports abnormalities. C. The UAP administers antipyretics if needed. D. The UAP interprets infection status. Answer: B. The UAP documents the result and reports abnormalities. Question 19. What is a nurse's responsibility after delegation? A. None. The task is now UAP's responsibility. B. Supervise and ensure the task was performed safely. C. Let the charge nurse follow up. D. Only review results if time allows. Answer: B. Supervise and ensure the task was performed safely. Question 20. Which client is best to assign to an LPN? A. A post-op patient requiring initial assessment. B. A client receiving for potassium. C. A stable patient with chronic wounds needing dressing changes. D. A patient requiring medication teaching before discharge. Answer: C. A stable patient with chronic wounds needing dressing changes. Question 21. Which task is safest for a UAP to perform for a stable patient? A. Educating on use of incentive spirometer. B. Evaluating urinary output trends. C. Assisting with a bed bath. D. Administering oral medications. Answer: C. Assisting with a bed bath. Question 22. A nurse assigns a UAP to take vital signs. What follow-up is most appropriate? A. Ask the UAP to report only abnormal findings. B. Review the documentation and assess trends. C. Tell the UAP to call the provider with results. D. Delegate interpretation to the UAP. Answer: B. Review the documentation and assess trends. Question 23. The nurse delegates ambulation to a UAP. What instruction is most important? A. Walk the client when you get time. B. Let me know if a client gets dizzy. C. Check the client's oxygen saturation first. D. Don't forget to chart afterward. Answer B. Let me know if the client gets dizzy. Question 24. A nurse delegates toileting to a UAP. What should the nurse do next? A. Trust the UAP will perform correctly. B. Review the client's skin integrity after the task. C. Check if the UAP trained others. D. Skip follow-up if client doesn't complain. Answer B. Review the client's skin integrity after the task. Question 25. Which task should the RN perform, not the UAP or LPN? A. Assessing a newly admitted client. B. Applying a warm compress. C. Repositioning a client. D. Administering PO meds to a stable patient. Answer A. Assessing a newly admitted client. Question 26. What is a sign of ineffective delegation? A. UAP refuses a task without explanation. B. LPN performs assigned dressing changes. C. UAP asks for clarification. D. RN checks completed tasks. Answer A. UAP refuses a task without explanation. Question 27. The UAP reports a client seems confused. What is the RN's priority? A. Ask the LPN to assess. B. Immediately assess the client. C. Document and check later. D. Ask another UAP to verify. Answer B. Immediately assess the client. Question 28. The LPN is assigned to monitor a client post-op. Which responsibility is appropriate? A. Evaluate effectiveness of epidural analgesia. B. Teach breathing exercises. C. Reinforce postoperative mobility techniques. D. Develop a plan of care. Answer C. Reinforce postoperative mobility techniques. Question 29. A client refuses care from a UAP. What is the nurse's best action? A. Ignore it if care is not urgent. B. Explain the UAP's qualifications. C. Assess the client's concerns and preferences. D. Ask another staff member to do it. Answer C. Assess the client's concerns and preferences. Question 30. Which scenario reflects safe delegation by the RN? A. UAP performs wound assessment. B. LPN monitors a client with a PCA pump. C. RN delegates colostomy teaching to UAP. D. LPN changes a chronic wound dressing. Answer D. LPN changes a chronic wound dressing. Question 31. A nurse assigns morning care to a UAP. Which instruction ensures safety? A. You know what to do, just handle it. B. Let me know if anything unusual happens. C. Take your time and get to it later. D. Be sure to assess skin condition. Answer B. Let me know if anything unusual happens. Question 32. Which situation requires the RN to intervene? A. LPN gives meds to stable post-op client. B. UAP measures intake and output. C. UAP teaches a client about diabetic foot care. D. UAP assists with feeding a non-dysphagic client. Answer C. UAP teaches a client about diabetic foot care. Question 33. What is the priority when assigning a team member to a new task? A. Staff availability. B. Speed of task completion. C. Staff scope of practice and competency. D. Staff preference. Answer C. Staff scope of practice and competency. Question 34. The nurse delegates bed-to-chair transfer. Which client is appropriate? A. Client with new stroke symptoms. B. Client with post-op hip fracture. C. Confused client attempting to climb out of bed. D. Stable client 3 days post-surgery with standby assist. Answer D. Stable client 3 days post-surgery with standby assist. Question 35. A client with dementia becomes agitated during hygiene care. What is the best action? A. Restrain the client. B. Instruct UAP to finish quickly. C. Stop and try again later with calm redirection. D. Sedate the client as ordered. Answer: C. Stop and try again later with calm redirection. Question 36. A nurse plans assignments for the shift. Which client must the RN retain? A. Client needing Foley catheter removal. B. Client with stable COPD on oxygen. C. Client receiving a new chemotherapy agent. D. Client needing reinforcement of education. Answer: C. Client receiving a new chemotherapy agent. Question 37. A new nurse delegates bathing to a UAP. What indicates need for further teaching? A. I'll give the UAP a report on the client. B. The UAP can check the client's skin breakdown status. C. I'll check on the client after the bath. D. I'll ask the UAP to report anything unusual. Answer: B. The UAP can check the client's skin breakdown status. Question 38. What task can the LPN safely perform? A. Admission history and assessment. B. Initiate a blood transfusion. C. Monitor pain level and administer prescribed oral analgesics. D. Teach colostomy self-care. Answer: C. Monitor pain level and administer prescribed oral analgesics. Question 39. A UAP reports a client has not voided all shift. What is the RN's priority? A. Ask UAP to give the client fluids. B. Perform a bladder scan and assess further. C. Document the report and reassess later. D. Call the provider immediately. Answer: B. Perform a bladder scan and assess further. Question 40. Which client can be assigned to an LPN? A. Client requiring continuous 4 insulin drip. B. Client requiring initial education on heart failure. C. Client with post-op nausea needing antiemetics. D. Client with new diagnosis of pulmonary embolism. Answer: C. Client with post-op nausea needing antiemetics. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.